Doesn't it feel good to take a deep breath? Now, in this video, what I'm going to do is talk about the anatomy of the respiratory system and the path that the air is taking to get from the outside environment to your lungs and out again. Can be arranged structurally or functionally. Structurally, we separate it into the upper respiratory tract, which is everything from the larynx forward, and the lower respiratory tract, everything from the larynx down. Functionally, we arrange it in structures that get the air into and out of the system, and structures where gas exchange takes place. So as we go through the respiratory system, we'll talk about how each structure fits into this organization. So first we have to talk about the air going in through your nose. It's not pretty. What's going to happen is that air goes through your nose and it's going to go past a lot of mucus and hairs. But that mucus and those hairs have a job, and their job is to get any foreign items out of that air, because what we don't want is we don't want foreign items getting all the way into our lungs, the gas exchange surface. So as you're breathing in, those structures in your nose are going to be catching foreign particles and keeping them from getting to your lungs. That mucus can be shed when you blow your nose and get rid of those particles. Once that air enters the nasal cavity, you have bones called conchae, and they get their name from a conch or a shell. Those are going to cause the air to swirl, and as that air swirls, it's going to get warmed and moistened. This is important for the respiratory process because you don't want to lose a lot of heat or water through your lung tissue. Next, that air is going to continue its path through the nasal cavity, down the nasopharynx into the pharynx, and in the pharynx, it will meet any air that would come through the mouth. So if you're a mouth breather, oh my goodness, no judgment here. If you're a mouth breather, the air is going to go through your oropharynx to your pharynx. Once in the pharynx, the next structure is the larynx. The larynx is the gateway. That is where the air will enter the trachea. All of these structures are upper respiratory. There are also structures that are involved in the conduction of air. No gas exchange has happened yet. We're just literally bringing air into the system or letting it out of the system. Let's spend a second with the larynx. The larynx is, again, that gateway to the lower respiratory structures. One of its goals in its laryngeal life is to try to keep any kind of food or water from going down into the lungs. To do this, there's this piece of cartilage on the larynx, which is called the epiglottis. That piece of cartilage is going to cover the larynx, and that's going to basically pass food so that it goes down the esophagus and not down the trachea, which is exactly what you wouldn't want it to do. That's what we call choking. So this is a really important structure. In addition, you'll see this connection between the larynx and the hyoid bone. What happens when you swallow is that hyoid bone is going to pull on the larynx and pull it sort of up and out. So forward, away from the esophagus, again, making it less likely that food will go down that trachea instead of the esophagus. Now, what I'm going to show you here is a video of someone swallowing on an x-ray, and you can actually see that larynx moving and kind of directing the food down the esophagus. When we look at the larynx itself, it's multiple pieces of cartilage that fit together. And as I rotate it, you'll see that there are some flaps inside the larynx. Those are the vocal cords or vocal flaps. What those are going to be used for is you're going to change the length and tension on those vocal flaps as you are talking. And that allows you to create different inflections. It allows you to create different pitches of sound. And if you push more air out, that's going to give you greater volume. you'll notice some people have lower voices than others. This is because their vocal cords are more flexy than a person with a really taut vocal cord. Someone with a really taut vocal cord, you can think about stretching a rubber band. If it's really taut, it's going to vibrate very fast. That would correspond to a high-pitched sound. In general, men have a much larger larynx. This is why they have an Adam's apple. Women do not. And that is part of why their voices are lower than women's. Now, when we look at the next step, remember the larynx is the gateway to the trachea. When we look at the trachea and we rotate it around, I want to point out some anatomical features. You'll notice that there are some C-shaped cartilaginous rings around the trachea. You can even feel them if you feel your throat. You can feel these little ridges. What those cartilage rings do is they keep that trachea open. But you'll notice that they're C-shaped, which means that they don't cover the entire back of the trachea, and that seems kind of weird, except that something really cool happens when you swallow food. When you swallow food, the epiglottis directs that food down the esophagus, and then what that food's going to do is it's going to bulge the esophagus into that tracheal space. That seems kind of weird, but this keeps you from breathing while you're swallowing, which means the food cannot go down your trachea. So then the food will go past that trachea, and now you can breathe. So it's yet another way of keeping you from choking. Not to say that you can't choke. Obviously you can, but there are several stops in place so you don't do it all the time. As we continue to follow the trachea downward, we get to 2 bronchi, one for each lung. Those bronchi are going to go into the lungs and branch into smaller and smaller branches. Bronchioles are smaller branches. And as they do this, eventually they reach a terminal area, which is almost like a little balloon, and that's called an alveolus. This is a thin epithelia which is used for gas exchange. So everything up until that alveolus is the conduction path of air. And then once we get to the alveolus, now we're actually talking about that transition of oxygen into the blood and carbon dioxide out of the blood. Let's take a minute and look at the gross anatomy of the lung. If you look at the lung, there's an area called the hilum, which is the root. This is where the pulmonary artery is going to be going into the lung, and the pulmonary veins are going to be coming out. In addition, it is where the bronchi enter the lungs. If you look close, you'll notice that the right lung has 3 lobes and the left lung has 2. This is because your lungs have to make room for your heart, and since your heart is hanging down towards the left, that means that you need to have a space for your heart to fit, and that's why the left lung has 1 fewer section than the right lung. These are thankfully named superior, middle, and inferior, so they're very easy to remember. I want to do a quick review of the structures that we've talked about going through the respiratory tract. We started at the nose. From the nose, we go through the nasal cavity, past the conchae, into the nasopharynx. There, we travel down toward the pharynx. Air from the mouth goes through the oral cavity to the oropharynx and eventually makes its way to the pharynx. Air from the pharynx passes through the larynx on its way to the trachea. The trachea splits into 2 bronchi. And those bronchi split into bronchioles and end in alveoli. So that covers the anatomy that we talked about today. Don't forget that the larynx is made of multiple cartilages, and you are expected to know about the epiglottis and its role, as well as those cartilaginous rings around the trachea and what they do. This concludes our discussion of lung anatomy. Remember that under the lungs you have the diaphragm, which is going to become very important as we talk about getting air into and out of the lungs, and that your lungs are surrounded by your rib cage, and your ribs also have muscles on them. Those muscles will also be important for moving air. We will talk about moving air in the next video.